On that note, can you kind of compare, in a way, kind of the effectiveness of traditional opioid addiction treatments, compared to, say, fentanyl treatments, as far as like, I guess you could say, what adjustments and treatment plans are typically necessary for fentanyl specific users that may not be used for, other types of opioid addiction treatment?
So what I would say is that it takes with fentanyl, it takes more finesse to get the medication on board, and then specifically to get it on board in high enough doses. Because fentanyl is so powerful, people's tolerance is just enormous, when they've been using for a while. So again, the challenge is trying to get the medication on board without without dragging them through the mud in withdrawal, so to speak, and then being able to get it up to high enough doses fast enough so that they're comfortable and so that you basically stop cravings and withdrawals.
How does fentanyl's potency and addictive quality affect the rate of relapse among those in recovery, as far as opioid use disorder goes? And beyond just that, are there certain strategies that are proving effective in reducing relapse rates amongst fentanyl users?
I think the relapse rates are probably very similar. The problem is that the potential results or consequences are disastrous. A patient's one relapse obviously may be their last, and so it's just truly the streets have never been more dangerous. The medications continue to work well. I think it's important to ramp up all the ancillary services such as counseling, meetings, a spiritual program, all the other things that go in to support the patient's recovery.
So I don't think it's a big secret, so to say, that from a public health perspective, obviously fentanyl is rampant and incredibly dangerous. But beyond just that, what impact have you seen that fentanyl has had, as far as not just from a public health perspective or within our communities, but how it's taxing the healthcare systems specifically as well too, and then and beyond just basic healthcare systems like hospitals, but treatment facilities as well?
Well, I think that if you went into any given treatment facility, you'd probably have a handful of alcohol use disorder patients, and the rest would essentially be fentanyl use disorder, opioid use disorder patients. So it's certainly taxing the system from that perspective. I know that especially up in the Northeast, there are long waits for spots in methadone clinics. There's the availability is not there. They've removed the Data 2000 waiver that allowed people, kind of a threshold, but allowed people to have certain amounts of training to be able to prescribe buprenorphine. Since then, in the last year or two, I guess they've removed that, and I don't think it's really impacted things. So it's certainly taxing the system, and obviously we have people dying at record rates.
So obviously one of the big keys that we like to do here on the Addictional Podcast is help raise awareness for topics such as these, so people can whether it's them directly or someone they know can get the help that they need. In your opinion, what education and prevention strategies are key in addressing fentanyl? And then also, what can we do as a society to help raise awareness about the dangers of fentanyl, specifically when you compare them to their less potent, opioids?
Well, I think that any kind of preventative education has to start really with junior high. If you look at the rates of opioid use disorder, binge drinking, almost any substance use at junior high level, and then you look at it at the end of high school in grade 12, you've got a factor of 3 increase. So you can triple those numbers pretty much across the board, and it's been that way for years. So certainly we have to start very early on and really get people to understand that, the streets have never been more dangerous as far as what's out there. And there's just honestly nothing safe to experiment with. Whereas, there used to be, was it always dangerous? Yes. Was it, typically or not uncommonly deadly? No, it wasn't before. And at least you knew what you were picking up. My analogy now is it's like walking along the street, seeing a gun laying by the curb and just putting up your head and pulling the trigger, not knowing if it's loaded, not knowing how many chambers are filled, it's truly Russian roulette. And especially in the new user who probably doesn't have the tolerance for any kind of opioids.